Well, if you have ever experienced a stroke or know someone who has, the effects can be debilitating. But new technology at St. Luke's Baptist is helping to change that. Here with me today is Dr. Ramesh Grandi, neurosurgeon with UT Health, and Michelle Patterson, director of stroke services at St. Luke's Baptist Hospital. Thank you so much for being here, both of you. Dr. Grandi, what is this new rapid technology?
Well, thanks for letting us talk to you about it. So, rapid technology is a great tool that we can use in the treatment of patients with a stroke. Specifically, the patients that we are trying to address are those with something called a large vessel occlusion. Basically, that occurs when a clot comes from some part of the body and wedges into a big artery in the neck or in the brain. And the people who have those sort of strokes are really, really sick. So what we try to do is identify which patients we can help by going in and threading a catheter and wire and just extracting that clot. And so Rapid is a tool that we can use in the armamentarium for treating those patients.
So you mentioned a little bit about Rapid. How much more does it change that treatment process?
Well, that's an excellent question. So when we see patients who have this large vessel occlusion, we want to determine whether you have any brain that can be salvaged. And Rapid technology is an automated form of software in which we can get a scan. It gets sent really quickly to a repository, and a computer system basically gives us whether that patient can be treated or not and has brain at risk or not. And it comes right to our cell phone or right to our email in the middle of the night.
It's amazing at how fast things are changing technology-wise and how much it's helping us. Michelle, what is the difference you're seeing in patients after introducing this technology?
I think one of the biggest differences that we're noticing is patients that otherwise were not eligible for treatment are actually now eligible for treatment. So we're able to offer an option. I think the other thing that is a big difference is patients that had devastating strokes where we did not anticipate that they would return home in a state of independence, being able to care for themselves. They are now actually able to go home and be independent. And sometimes this would be leaving the hospital within possibly 2 to 3 days or within a week. And so that's pretty amazing.
So how does it work when a stroke patient comes to the hospital?
When a stroke patient comes to the hospital, our stroke team's goal is to get the information as fast as we can so that our physician team can evaluate the patient, have the information that they need so that they can make treatment decisions. And so it really starts with individuals calling 911, and the 911 agency will call ahead to the hospital and let us know that we have a stroke patient coming in. And then we will take that patient directly to imaging, to a CT scanner, and our first order is to go ahead and get the imaging done so that we can get a picture of their brain, and then that information then will be shot over to our physician team. They can look at the brain imaging and then make treatment decisions from there. And so we're under a very strict timeline so that we can get all this information done and move on with treatment choices.
All right, we have about 30 seconds left, but before we go, for folks that may not know how to recognize a stroke, there is a fast way to be able to do that.
There is, and it's exactly that, fast. So we look for face, any facial weakness or facial drooping, arm, any arm weakness, and then S is for speech, any speech abnormality. Any one of those symptoms, it's time to call 911, so T is for time. We have to act fast.
All right, let's get the information up on the screen for you. You can call Baptist Health at 866-849-6153.